In 1994, a woman was admitted to the ER due to late-stage cervical cancer, only for hospital staff to become strangely ill after being exposed to her body and blood. Welcome to Something Strange. Gloria Cecilia Ramirez, born January 11, 1963, was a woman from Riverside, California. At this point, she had been suffering from late-stage cervical cancer. About 8:15 p.m. on the evening of February 19, 1994, Ramirez, suffering from severe heart palpitations, was brought to the emergency department of Riverside General Hospital in Riverside. She was extremely confused and was suffering from tachycardia and other respiratory distress. The medical staff injected her with diazepam, midazolam, and lorazepam to sedate her. When it became clear that she was responding poorly to treatment, the staff tried to defibrillate her heart. At that point, several people saw an oily sheet covering her body, and some noticed a fruity garlic-like odor that they thought was coming from her mouth. Registered nurse Susan Kane drew blood from her arm and noticed an ammonia-like smell coming from the tube. She then passed the tube to Julie Korchinski, a medical resident who noticed manila-colored particles floating in the blood. And it was at this point that things started getting out of control. Suzanne Kane fainted and was removed from the room. Shortly thereafter, Julie Korchinski began to feel nauseated. She was complaining that she was lightheaded, and she left the trauma room and sat at a nurse's desk. Another staff member asked her if she was okay, but before she could respond, she also fainted as well. Maureen Welch, a respiratory therapist who was assisting in the trauma room, was the third to pass out. The staff was then ordered to evacuate all emergency department patients to the parking lot outside the hospital. Overall, 23 people became ill and 5 were hospitalized. A skeleton crew stayed behind to stabilize Ramirez at 8:50 p.m. and after 45 minutes of CPR and defibrillation, Ramirez was pronounced dead from kidney failure related to her cancer. The county health department called in California's Department of Health and Human Services, which put 2 scientists, Drs. Ana Maria Osorio and Kirsten Waller, on the case. They interviewed 34 hospital staff who had been working in the emergency department on February 19. Using standard questionnaires, Osorio and Waller found that the people who had developed severe symptoms, such as loss of consciousness, shortness of breath, and muscle spasms, tended to have certain things in common. People who had worked within 2 feet of Ramirez had handled her intravenous lines had been at high risk, but other factors that correlated with severe symptoms did not appear to match a scenario in which fumes had been released. The survey found that those afflicted tended to be women rather than men, and they all had normal blood tests after the exposure. They believed the hospital workers suffered from mass hysteria. Going back to the medical resident, Julie Korchinski, she had denied that she had been affected by mass hysteria and pointed to her own medical history as evidence. After the exposure, she spent 2 weeks in the intensive care unit with breathing problems. She developed hepatitis and avascular necrosis in her knees. At this point, Riverside Coroner's Office contacted Lawrence Livermore National Laboratory to investigate the incident. In a bizarre finding, Livermore Labs postulated that Ramirez had been using dimethyl sulfoxide, a solvent used as a powerful degreaser, as a home remedy for her pain. Users of this substance report that it has a garlic-like taste, sold in gel form at hardware stores, which could also explain the greasy appearance of her body. Oxygen administered by the paramedics would have combined the dimethyl sulfoxide to form dimethyl sulfone. Dimethyl sulfone is known to crystallize at room temperature, and crystals were observed in some of her drawn blood. Even more bizarre is that the electric shocks administered during emergency defibrillation could have then been converted to dimethyl sulfate, which is a highly toxic dimethyl ester of sulfuric acid. exposure to which could have caused some of the reported symptoms of the emergency department staff. The Livermore scientists postulated that the change in temperature of the blood drawn from the 98.6 degrees Fahrenheit to the 64 degrees Fahrenheit temperature of the emergency department may have contributed to the conversion of these chemical compounds. But this, of course, has not been confirmed. 2 months after she died, her severely decomposed body was released for an independent autopsy and burial. The Riverside coroner's office held Livermore's DMSO conclusion as the probable cause of the hospital worker's symptoms, while her family disagreed. The Ramirez family's pathologist was unable to determine a cause of death because her heart was missing. Her other organs were cross-contaminated with fecal matter, and her body was too decomposed. On April 20th, 1994, 10 weeks after her death, Ramirez was buried at Olivewood Memorial Park in Riverside. In conclusion, it has been postulated as being the most scientific explanation to date. What I do find interesting about this case is that you have one set of investigators that concluded that it was mass hysteria, and then you have another set of investigators that concluded that a chemical compound changed states 3 different times while she was being cared for in the trauma room. And this is a story of, quote, the toxic lady or the toxic woman. So thank you so much for watching, and I hope you found this as interesting as I did. And please subscribe for future content and to help grow this channel.